I'm Carlos Vargas. I'm the Vice President of Adventist HealthCare, both in HR and technology, and also have the privilege of serving as the CHRO for Howard University Hospital since 2020. Almost 5 years now. We started very, very small with folks that were just sourcing and maybe to help with hard to fill jobs. We were having difficulty hiring recruiters. Another time that we also had a shortage in our own leadership, people being redeployed to other areas. HR had to do a lot of different things, and we've been called upon to do a lot of different things. Recruitment is so important and it's so personalized that some of the hesitations were, are we going to not have the personal touch? Human team really was able to engage with us on a personal level and understand and become part of our culture. You can't tell the difference between a human team member and a Adventist HealthCare team member. They learn the culture and they use their skill and professionalism to deliver their service. In HR, we're being stretched in many different ways, being asked to do many different things, but we can't lose focus on talent acquisition. So you got to really just have your time focus on that. And that's what the human team does. The other one that's really is the ability to scale. The human team just sort of taking the whole sort of ball of wax, if you will. In 90 days, they have a state-of-the-art ATS and a leadership team that is driving their results. So that's kind of the best example of being able to scale. Focusing on strategy. So if I know, I don't have to worry about talent acquisitions taken care of. We're gonna implement best practices. We got leaders in there that know what they're doing and they can do it. We can kind of move to the next step where are we going into the future. So being able to bring innovations and technology solutions to bear that we wouldn't otherwise know. The team was able to come back and say, look, we've got this technology solution that can help you float your nurses across your system, keep track of them, manage them, and so forth. So that was just invaluable. Are you comfortable with where you are today as far as being able to grow and scale and pivot? And are you nimble enough to meet the needs of the new this current environment? And you really have to answer that question for yourself. If not, you need to take steps to ensure that, because this is a critical one, especially in healthcare and other organizations. We're a talent-based organization, and so we've got to be able to be nimble and we've got to be able to pivot around things. They're just you. I mean, that's the only word I can say. They just become you. One of the things that's very, very close and near to our heart is that we start meetings with devotionals, inspirations. The human team participates in those and they embrace that. When I think of human, that's what I think of the team. They're very, very close. They're part of the family. We celebrate together, we grieve together. And we've done that over the last 4 or 5 years.